An intervention for toxic stress in children. Toxic stress can happen when children experience prolonged, unhealthy stress that can impact their brain behavior and health. Toxic stress can have an effect on the neural, mental, and physical development of a child. This stress in childhood is a concern because it can affect the child's ability to learn, regulate emotions, and form healthy relationships. These changes can continue even after childhood and can have lifelong consequences. One risk factor of toxic stress is abuse and neglect. Children who are exposed to any type of physical, emotional, or sexual abuse or even neglect can have a higher risk of experiencing toxic stress due to prolonged trauma. About 64% of U.S. adults have experienced at least one type of adverse childhood event, which includes abuse and neglect. Another risk factor would be household dysfunction. Children growing up in with parental mental illness, substance abuse, domestic violence, or instability are more exposed to toxic stress. 62% of Californians have experienced at least one traumatic experience during their youth, such as abuse, neglect, or household challenges like mental illness or violence, and 16% have experienced four or more. A third risk factor would be poverty and financial insecurity. The constant stress of food insecurity and lack of housing instability or extreme poverty can act as a contributor for toxic stress. According to ACF, even chronic stressors like low-income families' insecurity about basic needs such as housing, food, home energy, or medicines, though not traumatic, may be associated with problems in function. One protective factor would be having a safe, stable, and nurturing relationships. Children need support when they are struggling with toxic stress, and the relationships they make are important. A study done by PubMed Central found that adults who grew up with at least one parent/caregiver that made them feel safe and protected were less likely to have frequent mental distress and or poor health in life, even if they were exposed to high levels of stress when they were younger. Another protective factor is having a supportive and safe environment. A child's environment is also important, whether it is their neighborhoods, schools, or communities. A 2022 study by PubMed Central found that safe neighborhoods and supportive communities act as a buffer and protect children from adverse childhood experiences. A third protective factor would be resilience and coping skills. According to PubMed, research found that individuals with higher resilient coping abilities have experienced less stress and related symptoms, even though they reported to have experienced toxic stress during childhood. My intervention would be starting cost-effective community support and programs for children experiencing toxic stress. The idea came from the article Toxic Stress Effects, Prevention, and Treatment. The target group would be children at risk or experiencing toxic stress, and based on what I read in the book, I believe that this intervention would help children with toxic stress because children learn from their community, and these community support and programs can help children by providing a scaffolding on how to cope with stress. Some supporting evidence I found was Syrian refugee children have developed increased mental health problems, including PTSD and emotional dysregulation. An 8-week humanitarian intervention program of structured activities for 12 to 18-year-olds was held, designed based on the Profound Stress Atonement framework. The intervention reduced symptoms of insecurity, distress, and perceived stress, depression, and anxiety, and improved behavioral outcomes, but had no effect on prosocial behavior or symptoms of PTSD. Where and how? We would have to do them at community centers, public libraries, parks, schools, clinics, churches, and nonprofit spaces. They would be done by trained community volunteers, school staff or social workers, nonprofit staff members, and public health workers that have been trained on how to deal with toxic stress. The step-by-step would be to start by providing pamphlets to the community and volunteers via the clinics, schools, and community centers with free training on childhood stress, on how to deal with it. Then we'd have to get permission from community centers, libraries and schools, churches, etc. to be able to host these activities and teach the children how to deal with stress. Then we'd have to make an announcement on where this would be held and what times so that kids dealing with toxic stress can come and get help. Some potential barriers that I saw were limited volunteer availability, challenges in transportation for families, and the cultural stigma about mental health, where it's just an illusion, and also the funding might be inconsistent or not at all.